For coming. There's a couple of housekeeping announcements I'd like to make. First of all, the washrooms are just behind us to my left. Secondly, I just want to give you an idea what the agenda is. We have the media conference at 10:30 this morning. That will be the three of us presenting, and I'll introduce my fellow speakers in a moment, followed by any questions that the media may have. Then we're going to take a 45-minute break where we can move our cameras around. And then after that, Veronique is going to do a French translation or a summary for the audience of Dr. Carpenter and my remarks. And then we'll open that up to questions from the general audience. And then after that, we will start the formal submissions from the Canadians who are here in person and also who are Skyping in from across the country. So, Veronique, I think you wanted to make that announcement too.
OK, donc ce matin, nous allons procéder premièrement avec la conférence de presse. Ensuite, ce sera la place pour la période de questions pour les médias. Nous allons prendre une courte pause de 45 minutes. Ensuite, je vais revenir moi-même et je vais vous donner un résumé en français de ce que Dr. Carpenter et M. Clegg vont dire en anglais pendant la conférence de presse. Les citoyens, lors de cette période-là, vont pouvoir poser leurs questions et ensuite nous passerons à la période que ça sera la parole aux citoyens et que les gens pourront prendre la parole et on passera aux consultations publiques. Je vous remercie.
So we know that many of you have come from Montreal, and Dr. Carpenter is between engagements from China and California. So we thank everyone for taking the time to be here today. I would like to thank the Chateau Laurier Hotel for turning the Wi-Fi off in this room for those individuals with electrosensitivity so they're able to join us. My name is Frank Clegg, and I'm the CEO of Canadians for Safe Technology. People also point out that I was president of Microsoft Canada for 15 years. I like to remind them that I was involved in child internet safety most of my career at Microsoft. My wife and I raised our children while the internet was being born, and I was involved in developing anti-predatory awareness, tools to help law enforcement capture pedophiles, and spoke out about the importance of parental controls on the internet in Canada. I have an urgent message now about how wireless devices have proliferated our lives much faster than our understanding of their harmful effects. That's why I helped create C4ST, and that's why we're here today. Health Canada has invited public input into its revisions for Safety Code 6, the Wireless Microwave Safety Guidelines Policy. Our very strong message is that this safety code fails to protect Canadians from their own cell phones. It fails to protect children from all-day Wi-Fi in schools. It fails to protect anyone from a cell tower or a smart meter that may be located across the street or outside the window of their home or office building. Wireless devices are now in the hands of almost every Canadian, including children, and wireless radiation surrounds us ubiquitously everywhere we go. Safety Code 6 limits that were established before Safety Code 6 limits were established before the internet even existed. It is outdated and it's failed to keep up with the times. More importantly, it has failed to keep up with the established science. Other countries, including other countries, including China, Russia, Italy, and Switzerland, have updated with the times. Their guidelines are based on the evidence of biological effects from microwave exposure. That means cells start behaving differently. Citizens of those countries enjoy safety limits 100 times more stringent than ours. Safety guidelines for Canadians are still based on the outdated thermal effect. That means your skin has to get hot before it's considered dangerous. This guideline was developed when Canadians still listened to their music on 8-track stereos, not on microwave emitting devices like millions of us do now. It's time that our safety guidelines entered the 21st century. Today we will hear from Dr. David Carpenter, who who has decades of experience in this field. We'll also hear from Quebec Region Lead Veronique Riopel about what it's like to live with EHS, the medical term for electro hypersensitivity. And there are many supporters here today who will testify and make their own submissions that will be forwarded to Health Canada prior to the deadline of July 15th. I would first like to present the submission to Health Canada from a group of Canadian doctors. These are medical doctors specializing in environmental causes of illness. Many of them were the ones treating pesticide exposures, asbestos, secondhand smoke, and indoor air contaminants long before the rest of the medical system recognized it. They couldn't be here today as they're all running their clinics. However, Dr. Rena Bray, the Director of Ontario's Environmental Health Clinic at Women's College Hospital in Toronto, has agreed to speak with reporters if anyone would like to have further comment from a family physician. The Environmental Health Clinic is Ontario's only government-funded clinic that specializes in the environmental causes of modern disease. Dr. Bray reports that the clinic is receiving an increasing number of referrals from physicians across Ontario. Their patients are displaying symptoms that seem directly related to their exposure to or use of cell phones, Wi-Fi, cordless phones, smart meters, cell towers, and even baby monitors. Dr. Bray says that doctors in Ontario are alarmed by the lack of regulation around these devices and the absence of caution. To summarize today's submission signed by the Canadian medical doctors, they state, out of sincere concern for the health of Canadians at all stages of life, from the developing fetus through childhood and into adulthood, we respectfully request that, number one, Health Canada develop and support strategies to raise awareness about microwave radiation impacts and to minimize prolonged exposure to microwave radiation in schools and other places where children are regularly exposed. Number two, as Health Canada has acknowledged that a full literature review was not part of its latest update to Safety Code 6, we request a comprehensive literature review for all age ranges with less reliance on industry-funded studies. And finally, number three, Health Canada provide guidelines and resources to assist Canadian physicians in becoming apprised of microwave exposure and related health problems that may be associated with overexposure or sensitivity. This statement was prepared in response to Health Canada's invitation for public input on the scientific and technical aspects of its revisions to Safety Code 6. The doctors respectfully submit their statement, which is printed in full in your information folders. It includes references from current scientific literature. The Canadian doctor's submission is backed up by more than 50 of the world's leading scientific experts in the field of microwave and biological research. Dr. Carpenter will speak to the science declaration in a moment. Just before that, however, I feel it's very important to highlight that C4ST has identified more than 130 high-quality scientific papers which show that wireless devices can cause harm at very low levels. But these studies were omitted by Health Canada in its latest revision of Safety Code 6. Health Canada uses weight of evidence as their argument for dismissing these studies, but they do not publish their criteria or their formula in this weight of evidence evaluation. All this formula seems to do is exclude the studies that find microwave radiation causes harm. Through this elusive weight of evidence formula, Health Canada has omitted a significant portion of the evidence that evaluates the potential harm from wireless devices. So we've taken these 139 studies and broken them into 8 different topics. And what we found were 23 studies from cancer and genetic damage. 14 studies show harm to female and male infertility. 30 studies that identify impairment to development, learning, and behavior from conception right through to old age. 44 studies that show effects on the brain and nervous system. 7 studies demonstrating effects on the eye, and 4 with cardiovascular effects. The largest group, biochemical changes, had 65 studies that we've identified. Finally, we have identified 8 studies that show a link to electrosensitivity. All 139 studies have not been reviewed by Health Canada, and even more disturbingly, 75% of these studies, that's over 100, were submitted directly to Health Canada in 2013 by C4ST. Health Canada gets an F for effort on this update of Safety Code 6. C4ST is officially submitting again all of these studies as part of Health Canada's request for public input. Today, C4ST is asking Health Canada for 3 actions. First, invest in the necessary resources to re-engineer the process used to update Safety Code 6 and complete a proper, thorough review of Safety Code 6 based on international best practices. Number 2, respect the medical director's request to provide guidelines and resources to assist Canadian physicians in becoming apprised of microwave exposure and related health problems. And finally, number 3, minimize prolonged exposure to microwave radiation, especially in schools and other places where children are regularly exposed. As I said earlier, the medical submission to Health Canada is backed up by more than 50 of the world's top scientific researchers in this field. Among them is Dr. David Carpenter, who holds a medical degree from Harvard University and is currently director of the School of Public Health at Albany University in New York. He's also director of the Institute for Health and Environment, which is a collaborating center for the World Health Organization. Dr. Carpenter has authored 370 peer-reviewed publications and as well as written 6 books on this topic. By all accounts, he is a leading expert in the human health effects of environmental contaminants. Dr. Carpenter, welcome.
Thank you, Frank, and I'm very happy to be here this morning. 52 scientific experts working independently and through universities around the world support the submission to Health Canada by Canadian doctors. The reason we support this and assert this assertion and the request of these Canadian doctors is because Health Canada's Safety Code 6 is based on a false premise and outdated analysis of radiofrequency radiation research. Canada's Safety Code 6 is locked in the past and has disregarded or minimized many recent studies, such as those demonstrating DNA damage, effects on brain behavior, altered protein synthesis, stress responses, and detrimental biological and human health effects that occur at intensities well below the existing Safety Code 6 limits for human exposure. This means that Health Canada's guidelines do not protect Canadians against the exposures they may already be receiving daily from their wireless devices. The World Health Organization has classified electromagnetic fields at both extremely low frequency in 2001 and radio frequency in 2011 as, quotes, possible human carcinogens, end quotes. These are the same radio waves emitted by cell phones, by Wi-Fi, cordless phones, cell towers, smart meters, baby monitors, and an increasing number of consumer devices and products, such as refrigerators and automobiles. As Frank said, other governments have already begun to take the emerging science seriously. As with our understanding of AIDS, SARS, and other emerging public health crises, some countries adopt protective measures more swiftly than others. Our F exposure guidelines in Italy and Switzerland, China, and Russia are now based on the evidence of biological effects at low intensity exposures and have been adjusted to be about 100 times more stringent than those in Canada, the US, and the UK. These countries continue to rely on outdated guidelines still based on the scientifically antiquated belief that harm from radiofrequency radiation can only occur as a result of tissue heating. The reason that you can take your potato and cook it in a microwave oven is because the radiofrequency radiation alters cells in the potato. But cells are also changed at intensities that do not cause tissue heating. The governments, taking greater precaution, are saying that changing cells is unacceptable to its citizens, and it is no longer appropriate to wait until the body gets hot to understand that damage is being done. The purpose of medicine and public health is to identify those factors that will increase the risk of disease and to take steps to reduce exposure to these before a tumor starts to grow or other diseases appear. If this latest revision of Safety Code 6 is allowed to stand, it will keep Canada a generation behind when it comes to microwave radiation safety. The precautionary principle was developed at a United Nations conference and states that action should be taken when serious risks to the public and the environment exist without waiting for full scientific consensus on why it is happening. In other words, we should not wait for all of the I's to be dotted and the T's to be crossed before taking action to reduce our exposure to radiofrequency radiation. We understand that when a new threat is identified, the potential future impact is still uncertain. The public's health and the health of the environment are clearly threatened by the rapidly evolving wireless technologies. But with exposures increasing and coming from so many sources, the cumulative impacts of wireless radiation in Canada on human health has the potential to be great and to be underestimated at present. Let me speak to only one example of the inadequacy of Health Canada's review. The section on brain cancer is scientifically flawed. The report consistently ignores or diminishes published scientific studies that clearly show harmful effects at exposure levels below current safety limits. In another example, statistically significant changes to sperm DNA and sperm motility and viability have been found from cell phone radiation exposures well below what the average man receives from putting an active phone in his front pocket. Many studies have also shown damage to DNA from microwaves and from extremely low frequency radiation, but these results have been largely ignored by Health Canada. There are, in fact, so many concerns with the academic reviews relied on by Health Canada that there is a term for it in science, TMTC, too many to count. I will summarize our submission to Health Canada by stating here that scientists engaged in the study of electromagnetic field and radiofrequency radiation health and safety have serious concerns regarding Health Canada's Safety Code 6 guideline. We urgently call on Health Canada for the following. Number one, to intervene in what we see as an emerging public health crisis. Number two, to establish guidelines based on the best available scientific data, including studies on cancer, on DNA damage, on stress responses, on cognitive and neurologic disorders, on impaired reproduction, developmental effects, learning and behavioral problems among children and youth, and the broad range of symptoms classified as electrohypersensitivity, or EHS. And finally, number three, to advise Canadians to limit their exposure, and especially the exposure to children. Thank you very much.
Thank you, Dr. Carpenter. I appreciate your comment.